guys, this is Precious and welcome to my channel. Welcome back to my channel. Happy New Year to each and every one of you, and I hope this year will be a blissful one to each and every one of us. So for today, I am going to discuss the OSCE, or the Objective Structured Clinical Examination. OSCE is done by AFRA as well as the NMBA in Adelaide, Australia, in order to assess the skills of nurses who would like to become registered here in Australia. So after passing NCLEX or your OBA, you will be able to receive AFRA's approval to undertake the OSCE. So OSCE is being done after you receive a notification from AFRA that you passed NCLEX. So you will also receive AFRA's approval to undertake OSCE. OSCE's eligibility will be able to be shown on your dashboard. In your dashboard, you would then pay 4,000 Australian dollars. After you pay the 4,000 Australian dollars, you will receive confirmation of payment and receive your booking selection email. You may also select your preferred date via your booking selection email. After which, you will receive a booking confirmation email, submit any documents requested by the IQNM exam team, and you may sit for the OSCE. So after you sit for OSCE, you have to wait around 8 weeks for the deliberation. So they will send you an email whether you pass or fail. So if you pass, you may then register to AFRA. But if you fail, you may also apply for a retake. So after you pay the 4,000 Australian dollars, AFRA will send you an OSCE candidate handbook. So this handbook contains your examination preparation, as well as the dress code, the equipments, as well as the on how you would handle your personal belongings on the day of the examination. It also includes the suggested reading materials as well as the tips on how you will be able to complete your OSCE. Read the handbook because it also includes the rules to follow, as well as what will you expect before, during, and after the examination, as well as how they are marking OSCE and when they are going to release your result. So each candidate will be assessed using a series of practical skills. So this may include physiological observation, vital signs, calculating drug doses, subcutaneous or intramuscular injection, aseptic non-touch technique, in-hospital resuscitation, safe disposal of sharps, medication administration, wound care, hand hygiene, therapeutic communication and consent, infection control practices and patient identification, intravenous therapy administration and management, and lastly, the risk management for clinical environment. So it is very important for each candidate to also know the national standards of healthcare here in Australia. So that will also focus on Australian nursing standards, as well as the code of ethics and the code of conduct. So make sure that your communication skills as well as your practicum is in line with the code of conduct, code of ethics, as well as the nursing standard of practice. In your candidate handbook, you will also be able to find your reading materials. So make sure that you browse these ones, especially the Australian Commission on Safety and Quality in Healthcare, as well as the National Safety and Quality Health Service Standards. number 1 is thinks critically and analyzes nursing practice. Standard number 2 engages in therapeutic and professional relationships. Standard 3 is maintains the capability for practice. Standard number 4 is comprehensively conducts assessment. Standard number 5 develops a plan for nursing practice. Standard number 6 provides safe, appropriate, and responsive quality nursing practice. Standard number 7 evaluates outcomes to perform nursing practice. The Code of Conduct for Nurses includes Principle 1, Legal Compliance. Principle 2, Person-Centered Practice. Principle 3, Cultural Practice and Respectful Relationship. Here in Australia are different types of ethnicities as well as nationalities. So you have to know some of the points for each and everyone, especially their cultural practices, because they might include that, especially the ones for Aboriginal and the Torres Strait Islanders. Principle number 4 is professional behavior. Principle number 5 is teaching, supervising, and assessing. Principle number 6 is research in health. And Principle 7 is health and well-being. So Code of Ethics includes nurses and people, nurses and practice, nurses and co-workers, as well as nurses and the profession. So during the examination, you will be given a scenario. So each station has their different scenarios. So you will be given 2 minutes to read on the scenario and another 8 minutes to perform your skills in the station. You will hear a bell after 6 minutes while doing your skills for you to be able to know that you're nearly hitting the time. While doing the OSCE in the stations, you have to follow the process called API, or the assessment, planning, implementation, as well as evaluation. In the Philippines, we have ADPI, so that includes assessment, diagnosis, planning, implementation, and evaluation. But here, I think they are only using API. So during the assessment, you have to check the vital signs, to observe, to assess for the consciousness level of the patient, as well as check if there's any pain, how much is the intensity of the pain, and for you to be able to verify on what's the next step that you need to do. So for example, your patient is you read in your scenario that your patient's BP is low, like 98/42. So given that situation, you have to check whether the cuff is not working properly, or you have to re-cuff and check the consciousness level of the patient, check whether she or he had taken his medication. So all you have to do is to do the first nursing standards, which is to critically think on the current situation of the patient and thoroughly assess. When I was doing my conversion course, we also did OSCE. So I have printed out the registered nurses standards for practice, Code of Conduct for Nurses, as well as the ICN Code of Ethics for Nurses. And I can feel that these standards of nursing practice had helped me a lot, especially in tackling or on how I was able to pass my OSCE. And for preparation, you have to read and be knowledgeable with these standards of practice, because I think these three are the foundation of how you will be able to approach a certain scenario. So these three will help and guide you for you to be able to do your scenarios effectively and efficiently in a professional manner. Two of my friends had finished OSCE last November and October, so they have told me that there is no medical calculation, a separate one, but because in conversion course you will be able to have a separate examination for medical calculation, but in OBA the medical calculation will only be incorporated in some scenarios, especially when you are being asked to give a certain type of medication. So in giving medication, you have to demonstrate that you know your 6R. So 6R are right patient, right medication, right dose, right time, right documentation, as well as right route. One of the practical skills that you're being assessed is the patient identification. So here we have 3 patient identifiers. So that includes your patient's medical record number or MRN, your patient's name, as well as your patient's date of birth. So that's all for now. Thank you so much for watching, guys, and if you have some questions, feel free to put a comment down below and I'm going to answer it on my next vlog. So thank you so much for watching. If you like this video, please press like, and if you would like to have more updates regarding my vlog, please subscribe to my channel. You have a wonderful day. See ya. Happy New Year, everyone.